𝗘𝗫𝗣𝗟𝗘𝗃.
In the continuation of this series, today we are conducting a free ECG camp in the clinic. Dr. Arora is right now having his ECG done. ECG is a non-invasive, painless investigation which records electrical activity of the heart. Now, this investigation is the first investigation which you advise to any patient who is having a sudden chest pain, palpitations, dizziness and shortness of breath. Our heart works like a pump, and every beat is regulated by an electric signal which travels through the muscles of the heart. This electrical signal is picked up by the ECG in the form of different waves, and in either on a paper or on a screen. Like in this case it is appearing on a screen. These waves represent different phases of the heartbeat: when the heart contracts, when the heart relaxes, and when the new beat starts. Now, ECG detects heart rate which can be too fast, which is called tachycardia, which can be too slow, which is called bradycardia. It also detects rhythm of the heart, which can be regular, irregular. There may be missed beat, or there may be an extra beat. It also detects a heart attack, which either of the two types, either STEMI, which is called ST elevation myocardial infarction, or non-STEMI, non-ST elevation myocardial infarction. It also detects other things like electrolyte imbalances, certain drug toxicities, and also cardiomegaly, which is called heart enlargement. Besides that, a doctor when sees this ECG strip, he sees different waves. P wave, which represents the functioning of the atria or the upper chambers of the heart. The QRS complex is wide, and it detects the functioning of the ventricles, how the ventricles are contracting, or are major chambers of the heart which are involved in the pumping of the blood from the heart. And then ST segment, I told you, it detects heart attack. And then other things are the T wave. T wave detects the reversal of the contraction or relaxing phase of the heart when after the heart contracts. Now, even it detects old heart attack if it is, or a silent heart attack in an ECG. Now, what happens once this ECG strip is with us? We see the patient's symptoms and the signs and his history. We correlate and arrive at a diagnosis. Even if your ECG is normal, it doesn't mean that you don't have a heart attack, but it gives definitely some direction in this regard. Now, where we advise ECG? When the patient is having severe chest pain, left side chest pain, radiation to the arm, radiation to our neck, and patient with pain with severe palpitations, pain with fatigue and severe sweating, any patient with irregular heartbeat, or any patient who is having uncontrolled high blood pressure, patient with uncontrolled diabetes mellitus, all thyroid cases, particularly thyrotoxicosis, again there may be tachycardia, and it is also a routine screening test after 40 years of age, and particularly at younger age if you have a risk factor. And now, even if your ECG is normal, and even if you are very young, don't ignore your symptoms. This is a takeaway today. Don't ignore your symptoms, even if you are young, even if you are fit, because heart attack or heart problems can occur at any age and at any time. Or ultimately, I conclude with the message and takeaway that notice your symptoms carefully, and notice your heartbeat regularly, and let the doctor decide your rhythm.